really thrilled to be here so I can share my state of alarm with you regarding the state of our children's health. And by nature, I'm not an alarmist. I'm a New Yorker, and I'm a pediatric emergency physician by training. So alarm isn't in my nature, but so when I say I'm alarmed about this topic, and I'm also alarmed the fact that I've been doing this for 30 years. So I'll share some of my perspectives with you. I'm seeing certain conditions in children that are increasing, and some of these will be obvious to you. So I'm going to start with obesity. 17% of American children are now obese. I'm seeing a rise in asthma and allergies, particularly seasonal and food allergies on the rise. Autistic spectrum disorder, and this number will keep changing on the rate of autism now in children. And so the reason why it keeps changing is because the diagnostics keep changing and what they consider kids on the spectrum. But it's about 1 in 88 now children are on the spectrum. And it's way more common in boys than girls. And I'll spare you any sexist comments that are off-color. Can I do off-color Canadian comments? I'm not used to Canadian. Yeah, okay, I can go off-color, good. And so I'm also seeing a lot of ADHD, attention deficit hyperactivity disorders. And as you can see now, 1 in 10 of 14 to 17-year-olds are ADHD, and 5% of U.S. children are on medications. Autoimmune diseases, this is shocking. This was unheard of even 15, 20 years ago. I'm seeing boys with autoimmune disorders where your body, your immune system makes and attacks your own tissue, such as Hashimoto's thyroiditis, juvenile rheumatoid arthritis, and children with inflammatory bowel disease. I actually saw a few months ago an 18-month-old with ulcerative colitis, unheard of before. And childhood cancers are also on the rise a little bit, particularly leukemia, which is the most common childhood cancer. So I just want to say how I got into this. I'm not a political activist by nature. I'm a frontline doc. I'm a clinician. And some years ago, a woman named Debbie Friedman, who started this organization in where I live, which is Marin County in Northern California, called me. She was one of my patients. I took care of her son. And she said, I need you. And I said, what do you need me for? She said, I just need some pediatrician to be on our board as an advisor. And I didn't have any skills other than I had an MD after my name, and all I could think of was, oh crap, yeah, I got too much work to do. I really don't want to do this. But I thought to myself, Michelle, put your money where your mouth is and step up. So I decided to step up, and I got involved, and it was not as much work as I thought it would be. Well, that was good, but it was a little bit of work. And what we were fighting was the spraying of this guy, the light brown apple moth. And they were going to aerial spray all of California against this moth that makes little brown spots on apples. And we fought it. There was some spraying. We stopped it, and we won. So we were feeling pretty good about ourselves. And then we started going county and to Sacramento and to our state level. And one of the other founders, another gal named Lisa Krause, said to me, you know, Michelle, I'm really concerned about GMOs. And I actually said, why? You know, I thought they were fine. I knew what GMOs were, and this was some years ago, but I didn't know of any of the health risk. And she said to me, well, didn't you read this guy's book, Jeffrey Smith's Seeds of Deception? And I hadn't. I barely got through like the local newspaper at night when I fell asleep after about reading 2 paragraphs. And I said, okay, I've got to read this guy's book. So I read this guy's book, and on page 18 of his book, Seeds of Deception, I read about this guy. And his name is Arpad Pusztai. And actually it's Pusztai Arpad because I'm married to a Hungarian, and my mother-in-law would shoot me if I didn't get his name right. So that's how you do Hungarian names. You say the last name first. So Arpad was a researcher in Europe in 1994. They came to him and they said, look, yo, Arpad, we're bringing in GMOs here. Can you just take a look at them? He was a leading research scientist at the Road Institute, and he said, sure, I'll take a quick look. His area of specialty was naturally occurring pesticides in plants and leptins. And so he created a study where he took 2 groups of rats. He fed one group of rats GMO potatoes and one group of rats non-GMO potatoes. That's called a double-blind study, Basic Science 101. And this is not going to compare to Seralini's studies downstairs. I'm going to give you the clinician's perspective. But what he found really changed the way I practice medicine. It was so profound. And this is what he found. And what was very interesting, if he looked at the intestinal wall of these rats, fed both, the GMO, the non-GMO potatoes, and the stomach lining. And what he found was very interesting. here you see, barely, the normal well, if my snarky 15-year-old had fixed this for me, but anyway, the normal architecture of villus projections in the intestinal lining. Beautiful. Next to it were the GMO lining, and they were abnormal in the architecture of the lining. And I thought, well, that's interesting. Then, in the stomach lining, non-GMO stomach lining, perfect. In the GMO stomach lining, they were too much, hyperplastic growth, which is a precancerous type of cell growth. And I thought, This took me to my son's first grade class in 1998, where it was a pediatrician's diagnostic potpourri. Out of 20 kids, I could diagnose 10 of them with stuff. And I thought, oh, this is bad. This is bad. So I realized that what I learned through Jeffrey Smith and his publication of his book, of this guy's work 20 years ago, where we are now, GMO should have been halted right here, by the way. And that's what took me into my clinical work. And how I integrate this, I'm going to show you. I don't need to talk about him. I guess you were all downstairs and you heard. He is one of my heroes. I think Ann Clark said he's her hero. Well, he's my hero, too. I don't have that many heroes. I have a few. I'm the jaded New Yorker, but there's a few, and he's one of them. And it took his work, published in September of 2012. This is already 18 years after our pod's original work, to say, hey, look what's going on in animals who are fed these GMOs. And now this came out timely, right before the California, where we try to pass the labeling proposition. And I thought, wow, thank you, Gilles Eric, for trying to help us out here. We almost did it. We'll do it next time. But I'm not going to go over what his study found. You heard downstairs. But his study was frightening of the health effects, particularly on the immune system, reproductive system, endocrine system, liver system. And you can imagine what it's going to do with children. And it has to do with the way children, by the way, utilize food. Their metabolic rates are higher than children. They need more food per their size. Respiratory rates are faster, so they utilize more than you use. And they have different toxic effects at lower doses. And also, their livers don't detox as well. So children are not mini adults. So this is Jeff Goldblum. Some of you are probably too young to know who he is. I'm a fan. I'm also a fan of genetically modified movies. I'm also a fan of Michael Crichton, died too young, pancreatic cancer, right? Bad cancer. But this is where I think we're headed. You're going to have to go with me. I was a theater major way back when, so just kind of hang with me. So now let me go. I think I saw Gilles Eric get pretty passionate downstairs, and here's my opportunity to really bombast this study out of Stanford School of Medicine. And I read this study. This was published in September also, before the California election. You notice the timing here. By a gal named Dr. Bravata. She's a well-known researcher. She's been around forever. I don't know her personally, Dina Bravata. And I read her study, and I thought, who is she connected to, and why is she putting this study out there? So I Googled Dr. Bravata. In about 3 hits, I found out she had big agri ties, big time. And I'm thinking, come on, really? So what she said, well, she was going to publish her study, and that her study was that there's little evidence of health benefits from organic food. That was her study. She looked at 237 publications. And what she did say in one paragraph in her study is that 2 studies of children consuming organic, and that should say conventional diets, did find lower levels of pesticide residue in the urine of children on an organic diet, though the significance of these findings on child health is unclear. Dina, what are you talking about? So I questioned, what the hell is she talking about? She read 237 papers. Which papers was she reading? Well, then I have to say, well, let's ask, is the significance of finding lower levels of pesticide on child health unclear? Is it unclear? So I went to a publication that just came out in January from the U.S. Environmental Protection Agency. It's like this thick, and I read it. Well, I read most of it. And this just came out, and they said organophosphates, and they had a nice paragraph on organophosphates. And they said, well, it can interfere with the nervous system function in children, and it interferes with the recycling of neurotransmitters. Okay. Children can't detoxify. They have a lower capacity to detoxify in their livers. And also there was an association between prenatal exposure and ADHD, neurodevelopmental deficits, reduced IQ, perceptual reasoning, and memory. So that was when the EPA, our Environmental Protection Agency in the U.S., said, I said, Tina, did you read this? I guess you didn't read this. And so 1 in 6 children now with disabilities of the nervous system, and that was actually not in the EPA report, but from Lancet. 1 in 6 is huge. So let me go on to one more gal that I like to quote, and I'm thinking, Brenda, what the heck are you doing? Brenda Eskenazi, she's been a long-term researcher out of UC Berkeley in the School of Epidemiology, and she's been studying the health effects of organophosphates on children in the Salinas Valley in California, which is our big growing area, since before 1999. I think it was even earlier than that, and she just got her grant extended. She's been doing this for, I think, 14 years. And she has a website called Chamacos. It's some acronym, but don't ask me for what, but that's her stuff. And if you go to their website, it's got a beautiful website, and it's some little kind of thing. It also means little children. And she found that moms exposed to organophosphates during pregnancy had a shorter duration of pregnancy. The babies had lower neonatal reflexes, lower IQ, decreased cognitive function, and increased risk of attention problems. Now, I have a lot of friends who work over at UCSF in San Francisco, and they work in developmental pediatrics. And they've told me anecdotally that when they see a kid from the Salinas Valley to be evaluated for ADHD, they get nervous because those are their most difficult cases, the most aggressive and the most abnormal children. And I said, hello, Brenda, can you just like publish this worldwide? Like, why aren't we all knowing this? Why doesn't everybody know this information? She also found that some kids don't have a gene and the gene expression to break down the organophosphate. Some kids aren't as affected as others. Some of them have the enzyme, some don't. And that's what she discovered. For those who don't, they have a higher incidence of pervasive developmental disorder, which is on the spectrum. So it's like, duh. This is like a duh moment, isn't it? It's like, yeah, and so just, this is clear to me. So then more from the EPA. So there was one paragraph in this Environmental Protection Agency study on page 85, and I'll have to tell you what I did with this paragraph because I was kind of doing little WikiLeaks action there myself. And what it said is male rats exposed to high levels of glyphosate prenatally or during puberty may suffer reproductive problems such as delayed puberty, decreased sperm production, and decreased testosterone production. Now, where we are, in our area, you can throw a stone and hit a fertility clinic. The rates of infertility are profound. Duh. Like, what? Here it is, right? In our government production. Now, you know, U.S. government is infiltrated with Monsanto X's. You know, Robert Taylor, they're all in there. Clarence Thomas, he's an ex-Monsanto boy. These are Monsanto people. They're all in the U.S. government. So you can see, but our publication had put it out there. So I made one phone call to a woman who's trying to get GMO labeling on 37 states. She didn't know about this one paragraph in the EPA report. She now has it in her hand, and off we go. So we're having a tactic now. Our tactic is to put every state to get a measure at the same time, diffuse Monsanto money. They targeted California, but can they pocket $47 million to every state? I doubt it. See, yeah, we changed our tactics. Yeah. We had to lose one state, but we got it this time. We figured it out. So what this says here is, Wilson's working on a genetic program that will make modified vegetables 100% organic. So I just want to say that as I was preparing this talk, stuff keeps coming in my mailbox. I am on this email, you know, I don't know what circuit that as soon as something's out, I've got like 10 hits in my inbox about what's going on. And Monsanto right now is alleging seed, it's not patient but patents. That was a subconscious slip. And they're filing 144 lawsuits against 410 farmers and 56 small business farms in 27 states. And it's going to the Supreme Court as we speak. It's a case from Indiana. So this, and before, it didn't hit the Supreme Court because they had these guys filtering out these cases and kicking them out, the Monsanto plants. But now it's hitting our Supreme Court, and we know that the tide is turning. We know this, you all know this, dramatic increase in price of seeds, seed diversity is down, more chemicals are being used, and you heard that from Sarah Lini's talk. I won't focus on that. But again, another hero for me, this is Percy Smizer. He's your local Canadian guy, and he took on Monsanto. So yeah, I think I've identified quite a few heroes. And I said I was so jaded, but no, I have a few, and here they are. So now I'd like to get into a little bit of the clinical medicine of what I'm actually seeing. I work in an integrative health clinic in San Francisco, Marin County in the Bay Area, and I practice both Western medicine, integrative health, and homeopathy, and I have to say it is a stretch. Homeopathy is the poverty child of integrative medicine, and this was huge that they let me in the door. I just try to fly under the radar because Western docs don't like homeopathy, particularly in the U.S. I don't know how they feel about it up here. And so I'm seeing there's not a day that goes by that I don't see a kid with a health effect that I think is related directly to genetically modified food. So I'm going to tell you about this little boy, and I just saw him recently. This is a recent kid that I've seen, and I want to tell you what a kid in my office looks like and what I do, and how do I approach this, and how do I integrate some of this stuff from Arpad Pusti and Seralini into clinical work. Is it clinically relevant? And it is. So he came in with his parents from the Sacramento area, and which is a highly pesticide area of California, with ADHD, violent outbursts in behavior, and now his outbursts were so profound he had to be homeschooled, and he didn't want to be homeschooled. Really social, talkative young man. Obesity, profound. Environmental allergies. He was on 3 drugs for anxiety and focus. He was one of 5 boys in the family, and 3 of them, he had 4 older brothers, and 3 of them had neurologic issues. Everything from Asperger's to being on the spectrum. One had seizures. So they all had some kind of environmental exposure, or perhaps it was from the mother, or it was perhaps his epigenetics. Hard to know what exactly caused it. But anyway, so I'm looking at my little boy, CS. And so how do I do my first steps? How do I even approach this kid? Well, I do the typical, as you know from your pediatrician's history and physical exam, always. And the first thing I did was a food antibody testing from one of the labs I use. I use several, Genova, US Biotech. There were different labs I use. And I look at IgG and IgA and other antibodies to foods. Not the IgE ones, the ones that if, for example, kid eats a peanut, they develop respiratory distress. Those look like at IgE, an antibody. And those are the ones the Western docs typically test for. This is a lower class antibody with lower grade chronic inflammation is IgG, and that's the most common one I use. And I try to be careful of parents' expenses because insurance doesn't cover most of this testing. So I really have to be judicious in what I'm doing, and only if these labs are going to really help me. So while I was waiting for the food test, I put him on an organic diet, no GMOs, and they didn't know what GMOs were. So I had to explain the whole thing. I removed all gluten and dairy from his diet, and I'll explain in a second why I did that, and I think Julie might go into a bit with that as well. I took him off all processed foods. I had them send me an iPhoto with their smartphone from their pantry to show me what their pantry looked like. It was like an oh my God Costco moment. I said, get all that crap out of your pantry. I said, don't even donate it. Just get rid of it. Burn it. I said, this is bad stuff. All processed food. No nutritional value. The kid was eating cardboard, for Pete's sake. I put him on some probiotics, and I love probiotics. Vitamin D3 for his immune support. It's a hormone. Omega-3s, anti-inflammatory, antioxidants. And I did a homeopathic constitutional remedy for him as well. So I was kind of doing a few things at once. And also, oftentimes, when you do several things at once, you may not know exactly what works, but I didn't care. It didn't matter. I just needed to get him better quicker and give this boy some success. I also need to give this kid success is because the parents are stepping so out of the box that I need for them to see that this can work, or they'll get discouraged and I won't ever see them again. So I have a window of opportunity to create the belief in the family that we can make change and that diet matters. So this is a US Biotech report. They're out of Seattle. And this looked at dairy, and I apologize for it's up there. It's just basically dairy, and it just kind of rates how much antibody this kid has. And it looks at about 90 some odd different foods. And in this one I ordered for him I looked at different antibody levels. And he had food antibody to every food group. Dairy, fruits, veggies, everything was positive. So you should have 0 food antibody to foods, none. And he had every single food group lit up. So is it possible that he was allergic to every single food group? This is allergy, we think, or is it not? So what was going on with this kid is sometimes I cannot always delineate what's a leaky gut and what is true food allergy. So leaky gut, which is called increased intestinal permeability, is what I think GMOs have caused. From that other slide that I showed you with the intestinal villi, little projections there. So the gut now should have really tight junctions in your gut lining. And I think GMO food has caused this abnormal architecture. The gut is now leaky, and then these large food molecules are passing before they're adequately broken down, along with toxins, microbial stuff, you name it, plastics, everything, are coming through. Your immune system, hovering on the other side, recognizes this as a foreign invader and makes an immune response. You have to know that when your immune system is activated, it's exhausting. It takes a lot of energy to be running your immune system, and these kids are tired. They're fatigued, and then they don't want to play and go out. They're really energetically depleted. So this is what I think is going on. It's really hard to know if there's a leaky gut for sure. The food antibody test is not a direct measure of a leaky gut. It just gives me some information. I don't think this kid had allergies to every single food group. I think he had leaky gut, and he was reacting to everything. So I don't know what he's truly allergic to. There are other tests I can do. One is where you give kids these sugars, lactulose and mannitol, and then you check their urine afterwards. And you can see you shouldn't have any lactulose in your urine, and you should have mannitol. Lactulose should not pass through. It just goes out your gut. And if it does show up in their urine, it's leaked out of their gut, and it's passed into their bloodstream. And it'll come out through, filter through the kidneys and out in the urine. So that's one thing I can do. And sometimes I like to do something called a comprehensive digestive stool analysis. Genova does the test. And I like to look and see what are their levels of bacteria, healthy bacteria in their gut, if they're pathogens, and how they're digesting. So I can do basically, it costs about, if a patient doesn't have insurance, I could run everything about for $600 outside. So that's what it costs. But one study I just wanted to share with you, it just kind of rocked my world, because I've only learned about this study a few weeks ago. And it was a veterinarian study out of Leipzig, Germany. And they looked at the effect of glyphosate, product in Roundup, on pathogens and healthy bacteria in your gut on poultry. And they studied the impact. And then what they found, that highly pathogenic bacteria like Salmonella, Clostridium, were highly resistant to glyphosate. And the beneficial bacteria, like Bifidus and Lactobacillus and Enterococcus species, were being killed off. And this was crucial, because now I know that the Roundup is or the glyphosate rather, is letting the hardy bad pathogens survive, the good stuff that you need for normal immune function, as well as vitamin production and a whole host of other things, while you need a healthy biome is dying off. Another reason not to eat this stuff. Okay, so this is another Jeff Goldblum slide. Now, if anyone knows Jeff Goldblum and wants to introduce me, you can feel free. Have you all seen The Fly? Oh, everybody see The Fly. Fly remake? How about the original Fly? You all saw the original Fly too? Oh, some older people. I know who you are. I see you. So another genetic modified movie, one of my favorites. And I swear, this is what's going to happen. I'm convinced. This is where we're headed, right here. So let me tell you what happened to CS, my boy. 3 weeks later, I saw him back, and he said his mood was better. He said he wasn't having outbursts, the violent outbursts. He was less puffy appearing, that his tissue turgor and the way he looked was much improved clinically. He had weight loss, first time, and he showed me. And he said to me, because I am better, everyone in my family is happier, which makes me happy. And that got him 2 prizes from the prize box. So I just want to mention some other factors leading to this leaky gut. I think it's the GMOs causing the changes in the gut architecture for sure. That would be one. I think it's this gut dysbiosis that we're seeing, likely again from GMO, from Roundup, from glyphosate, and as well as kids being on antibiotics, and probably too many of them. And there are other contributing factors. I don't want to oversimplify this. Kids have nutritional deficiencies, which you heard from the Symphony of the Soil. The soil is depleted, and so they're not getting magnesium, A, the zinc, the vitamin D, calcium that they need. A lot of babies are put on formulas. Don't get me started on formula, particularly soy formula. It's like I don't know what were people thinking. Bad stuff. But I guess we could do that as another lecture, soy formula. And this is leading to something I call leaky brain. I didn't coin leaky brain. Leaky brain. And then I had the realization that my guy, CS, from his gut inflammation, had a secondary leaky brain with brain inflammation. And we started healing his gut, and we started healing his brain. And so we know that there is a link between obesity and neuroinflammation of the CNS. And I just want the central nervous system. I think I'm talking to a bunch of medical people here. I'm not. And so I thought to myself, what's happening in the brain? And I had to go back and read about this. This is not being published in my pediatric literature. So when I read Journal of Pediatrics, American Academy of Pediatrics, there's nowhere I'm going to read about this. I have to go into the alternative literature. And so I just want to say, what is this leaky brain? Because I think this leaky brain is what's giving our kids an issue with the autistic spectrum, the ADHD, is brain inflammation. So 90% of the brain input goes into the vagus nerve, which innervates the digestive tract. That vagus nerve comes right down here. So for example, if you had a difficult delivery and the baby's head got smushed, right? Compression on the vagus nerve, baby's refluxing like crazy, right? Spitting up like crazy. So those babies, I sent to see the craniosacral osteopath immediately. I'm a big fan of craniosacral osteopathy in babies. All the kids I send, particularly in difficult deliveries. If the brain is not firing well, poor gut activity. Increased growth in pathogenic bacteria and yeast, causing leaky gut and inflammation. The gut inflammatory mediators, they're called cytokines, cross the blood-brain barrier. It's not immune. It can be leaky. And you activate these immune cells in the brain called microglial cells. When microglial cells get activated, they don't turn off. They stay permanently inflamed, this problem. And this leads to depression and reduced vagal nerve activity again, and then the cycle starts all over again. So if you have a kid with ADHD, a kid on the spectrum, a kid who can't focus in school, impulsivity, you have to start by healing the gut. If you don't heal the gut, you're never going to heal the brain. It's a connection. There's this gut-brain axis. You know how you say, I have a gut feeling? How many times have you said that?
I have a brain feeling.
Well, I need some more brain feeling. So what's my plan with CS? So I have a plan for this guy, and I don't have to see him back very often. He's going to get better, and he's going to get probably at least 90% better, and my goal is to get him off drugs. Organic, non-GMO, gluten, dairy-free diet. I think I say that about 10 times a day in my practice. I started him on a homeopathic detox, clearing out his kidney, liver, and lymphatics using homeopathy. I'm going to do some homeopathic gut healing, and I use remedies to clean out the cells, extracellular matrix cleaners. I have remedies I use for cellular regeneration. I have remedies I use for cellular immodulatory remedies. I put him on an exercise program. This boy needs to move, and so an increased flow to his brain. And eventually, when he's healthier, I'm going to do a DMSA. I'm going to give him a chelating agent and pull out some metals from his bone and see if he has heavy metal, which often these kids do. And then I can deal with that homeopathically as well. I may take a look at his neurotransmitters. These kids often have elevated levels of neurotransmitters which don't shut off. So they're kind of constantly wired. They don't turn off. And I will continue on his homeopathic remedies, which I have to kind of keep tweaking. This kid is on homeopathic tarantula, just to give you an idea. So turning the tide. I'm an optimist, a jaded optimist, I guess. So I just want to talk about lead paint. Well, I am the tuna, and you know I'm dolphin-free, but baby, I'm loaded with methyl mercury. My boy, by the way, had a mouthful of mercury, and that's unusual. Usually 11-year-olds don't have any more amalgams. We got rid of those. If you've got a mouthful of metal and you've got health issues, I suggest you get rid of it. Yep. You can't get me started on dentistry and how much damage they've done. I know they didn't know, but boy, we're in a big mess because of dentistry, traditional dentistry. You have to see biologic dentist. But anyway, I'm concerned about lead. Before I get to my wrap up, I think I lost a couple of slides in transit. But I'm concerned about lead because in 1936, there were pediatric publications saying lead's no good. Neurocognitive defects, neurologic issues, it's not reversible. And it took in the U.S. 30 to 40 years to get rid of lead. But we had a massive campaign to get rid of lead in paint, in gasoline, and we did. And actually, lead levels are lower in children. It actually worked because I test lead levels, and they're usually quite low for most children. We actually succeeded there. So what I used to tell parents when I gave these talks in the past, I used to talk about the power of the purse. That if we spent our money on organic food and quality products, that industry would see our purchases and make the shift. That it took about 5% of us to shift, and there would be a tipping point. Now, the jaded Michelle Perro comes through, and I'm not so sure about that. I really think we need for governments to step in. And I think the government has to work on chemical reform and practice precautionary principle. I think we need federal mandates to say that this stuff has to stop. And that's where it has to come from. But I think we can do it. I think even in the U.S., the bastion of Monsanto, St. Louis, Missouri, you can go visit their plant if you like, that even Monsanto is going to come down because of this worldwide phenomenon that we're dealing with. So I practice in my little practice in Marin County in San Francisco, but I think we're seeing this ripple effect, this global effect. And that's what I'm counting on, is that every grassroots activist out here, that we all begin to emanate, and then I think we can have a federal effect just to ban GMOs and promote organic food for children. Thank you.